I want to start off by saying I'm not getting any compensation for being here. David is not giving me any money, no in kind. He's not knocking off anything off his service fee. Not a bad idea, but he's not doing that. The reason I'm here is I'm in business, and you're in business too. And one of the things that we can do in business, we can make money, and we can also save money. And healthcare is something of the last number of years that has been increasing in cost dramatically and rapidly. I want to take you back and tell you my story. In 1981, my company, Caspers Company, went self-insured on our health plan. And our company, just to give you a little perspective, right now we own 64 McDonald's restaurants, mostly Tampa Bay area, a few up in Jacksonville also. We also own a restaurant service company that services equipment, installs, and so forth. And we also have a cold storage company. And my boss is into a lot of other businesses too, such as the Oxford Exchange. Ever been to that in Tampa here? My boss owns that, as well as some other ancillary businesses. So altogether right now we have about 4,000 employees. We have, in that 4,000, about 620 qualify for a health care plan, the rest are part-time. Altogether, right now, we have about 1,100 lives insured, which includes the dependents. It's a lot of people. Take you back to 1981. Concept was brought to us to go self-insured, save money on health insurance. We did that. And so we worked with TPA. We didn't have any network back then. Networks weren't real huge. So as time progressed, we saw a need we needed a good network. So what we did a request for proposals out there, and this guy showed up at our doorstep with Humana. That was David. And they brought in a concept for self-insurance under an ASO, Administrative Services Only contract, where we would use Humana's network and their discounts, and they would basically administer the plan for us. Started out great. First decade of that was 1992. First decade of that, we did very well. And all of a sudden, we saw around the year 2000 or so, things began to change. David had already left them, by the way. He was already gone away from Humana, so we weren't dealing with David. We only had David for, about 3 years, David, I think, as our rep over there. So things began to change. Transparency was going away. The rebates on our prescriptions were going away. They said, we'll add it back to savings on an admin fee. Well, how do I know that? How do I know that? There's no accountability for that. So we saw all these things begin to disappear. I don't know what kind of discounts we were getting. I had no clue. The only way I knew, once in a while, on a large claim, I get these emails and it would say, you have a claim exceeding this. And once in a while, the person sending me the email would make a mistake and show me the actual real cost from the hospital. And then they would show what our discount was. I felt pretty good about that. So those large claims, I was getting 30, 40, on occasion even 50% discounts. I was excited. Well, then things began to, costs began to keep going up. Thinking, what the heck? We're doing all these things right, supposedly, and costs continue to go up. Of course, our consultants at the time, we were with Mercer. Anybody know Mercer? The biggest in the world. They should know what's going on, right? Well, they should, but they didn't, apparently. We're all stuck in this vortex, this just giant sucking sound, to quote a politician from years ago, just sucking us right down into this abyss of nothing but increased costs. No matter what we did, Humana would come in, presented let me tell you, a great stewardship report. Man, you guys, this, and this, you need to work on this. How do we work on that? Well, we'll send you some flyers. Well, that's not going to do it. So we took a step back about 11 years ago where we went into a high deductible plan. That's great, right? Yeah, except for one thing. What are we really doing? We're passing cost on to the employees. And how much can they really take? How much can your employees, without big pay increases, how much can they take on increased cost? And in our business, some of our people don't make a lot of money. In fact, our late owner, Joe Casper, once said, at least if they're not making a lot of money, we'll provide great health care. And now all of a sudden, that wasn't happening anymore. So I was getting increasingly frustrated with this system that was out there. A system that lacks transparency, lacks communication, lacks answers, and all we saw was an increase in cost. So 2 years ago and 1 month, 2 years and a month ago, I was sitting right where you are. And David had approached me a couple of times since he had started Cost Plus about this. And for some reason, it wasn't gelling in my mind. But when I came to this seminar 2 years and a month ago, here I am sitting right where you are, and I hear everybody get up that's part of Cost Plus, and this is what we do. This is what we do. This is what we do. And all of a sudden, it began to coalesce in my mind, this is what I need to do, okay? So we got involved in it. And so for the next number of months, we're already still committed to Humana. The next number of months, we work with David and Bob and sending them report after report. Anything that we could pull out of Humana, they'd be willing to give us. And they did work with us, I will say that. They did work with us. It took a while to get some reports, but they did work with us. And so we get these reports in, and I send them over to David. And as time progressed, what we saw was a way to save a lot of money. So we decided to institute the plan. By the way, David and Matt and a couple of others came to an executive seminar, just our people only. Our boss was there, Blake Casper. So we're going through this seminar, similar to what you'll hear today. And the words of Blake Casper to me was, how soon can we get into this? So obviously there's timing on everything. So we worked with Dave, we got everything in place, and so December of 2017, we put this in place. So we have over a year now in this. So what kind of results did we have? That's a good question to ask. Well, as you know, if you are with any kind of a carrier right now, they come to you, your consultant or the carrier, if you're directly with a carrier, will come to you and say, hey, I got you a 5% increase this year. And maybe 5%. Yeah, but hey, Billy down the street, Billy got 10%. So you're lucky, you got 5. Oh, wow, you feel good about 5%. I'd like to feel good about decreases, not increases. I like to feel good about increases in sales, but not increases in expenses. So the first year, how did we end up? We saved 15%. For us, it was almost $500,000. That's a lot of money. That's money you can take to the bank. By the way, what's interesting about that, that's dollar for dollar versus the year before's P&L, almost $500,000. Let me tell you something else. That's not the true savings. Let me tell you what the true savings was. We were up 8% in our population. We're going against anywhere from 8 to 15% increase in medical inflation. So you add those up, and if you put it all together, our savings were really between $700,000 and $1 million, depending on how conservative or liberal you like to be with the numbers. So we saved a lot of money, real numbers. At the end of the year, one of our division presidents told me, he said, Ed, you saved my bacon in December. I said, what do you mean? He said, well, last year they had to add to the P&L for December to cover the health care costs the year before. This year, we actually put money back into the P&L. We didn't take it away. So that was nice. So with when you're self-insured, by the way, if you're not self-insured right now, you're stepping into a whole new world. And one caution I would give you, don't ever get into self-insurance unless you're really interested in saving money. If you're interested in saving money, it takes also a little bit of your time. And if you're the kind of person that likes to have a turnkey situation and walk away from it, this is not your solution. This is a solution you'll be involved in. Now, did I mind being involved in it? $500,000? No. That was really small, my involvement to save $500,000. In fact, every month I enjoyed seeing the savings come in as I compared our cost to previous Humana cost. One of the nice things about Cost Plus I like too, besides the fact we save money, is that it's an ever-evolving proposition. It's not like, here it is, we're stuck in this, and this is how it's going to be. It's like, we need a solution for this. They go out and get it for you. For example, one solution, one problem we had was excess ER expenses. A lot of our people, this is the first time they've ever had health insurance. They're coming off Medicaid, they're coming off no insurance at all. So what happens is they end up going to the ER as their primary care doctor. That's not a good solution. That's a very expensive solution. And even though Cost Plus through ELAP will save you a lot of money on that, it's still an expensive solution. So what do they come up with? Hey, we got an idea here called United Concierge Medicine. They brought that into us, okay? So now we're saving money on that. By the way, Laura, where are you? She left. Oh, to my left. Sorry. I thought you said she left. There you are. There you are. They do a great job. I know Laura's going to come up later. I just want to give you a little plug ahead of time. They do an outstanding job. I've had people say, they call me back in 5 minutes, 10 minutes, 15 minutes. And they have solutions that saves your employee time and money, also saves the company money because they're a one-fee deal. And she'll talk to you about that. All I can say is, for my company, for a solution to healthcare, Cost Plus was the answer. And I hope you'll listen today. Listen with an open mind. If you want to ask questions, they're all here to answer your questions. And this is not a scam or a scheme. This is a real solution to save money on healthcare. And the other part of this, I forgot to tell you, is our people, not only did we not have to go up on any cost sharing, they actually got a better plan benefit. They got lower copays. They got a better solution for them and less out of pocket. So it was a win-win for everybody. Our employees won because they had less money to pay out, and we won because we saved money overall.